Have you ever wondered about the impact of avian influenza A, H5N1, on our health and daily life? Commonly known as bird flu, this strain of influenza originated from wild birds, but has since crossed species boundaries to affect domestic poultry, and in rare instances, even humans. In fact, just this month, the United States reported its first ever case of avian influenza A, H5N1, in Texas, linked to an individual who had contact with infected dairy cattle. In humans, the H5N1 virus can cause symptoms ranging from conjunctivitis to severe respiratory illness. However, it's important to remember that human cases of this virus are quite rare and are primarily linked to direct contact with infected animals or contaminated environments. It's not a common sight in general population, and the public health risk is assessed as low. So while it's not something that should keep you up at night, the recent case in Texas does serve as a reminder of the need for ongoing vigilance when it comes to emerging infectious diseases. While human infections are rare, the recent case in Texas has brought renewed attention to this virus. So what happened in this recent outbreak and how did it affect us? In early April 2024, a case of avian influenza A, H5N1, was confirmed in an individual over 18 years old in Texas. This person had been in contact with dairy cattle, which were believed to be infected with the virus. The patient was treated with antivirals after presenting with conjunctivitis, a common symptom, and showed signs of recovery. Following this, the USDA detected the same strain of influenza in dairy cattle across several states. This virus, belonging to the 3.4b clade, has rarely infected humans and is primarily associated with direct contact with infected animals. The spread of the virus led to increased monitoring and testing of cattle herds, and infected animals were culled to limit further transmission. Despite the rapid spread of the virus among animals, no additional human cases were identified. While the outbreak caused concern, the Centers for Disease Control and Prevention, along with the World Health Organization, assessed the public health risk as low for the general population. Despite the outbreak, the public health risk was assessed as low for the general population. In the wake of the outbreak, how did we respond and what safety measures were put in place? As the news of avian influenza A, H5N1 spread, the public response was swift and measured. Cal-Maine Foods, the nation's largest egg producer, paused production at one of its facilities as a precautionary measure. In tandem, there was a significant ramp-up in testing and monitoring of flocks across the country to further mitigate the risk of the virus spreading. Safety measures were also emphasized, particularly in relation to food handling and preparation. The authorities reassured the public that the risk of buying infected chicken was low, and that proper handling and cooking of poultry would further reduce any potential risk. Eggs received similar advice, with emphasis on thorough cooking to inactivate any potential virus. Moreover, the role of pasteurization was highlighted, both for eggs and for dairy products. This heat treatment process effectively eliminates the H5N1 virus, and as most milk consumed in the US is pasteurized, the risk associated with dairy was considered minimal. With these measures in place, the risk of infection from eggs and poultry remains low. So, where do we stand now with avian influenza A, H5N1? As it stands, the situation is under active surveillance by the Centers for Disease Control and Prevention, along with the World Health Organization. The United States has recently reported a case of the virus in an individual with direct contact to infected dairy cattle. However, it's important to note that no additional human cases have been identified and the risk to the general public is assessed as low. In terms of our food supply, while the virus has been detected in dairy cattle across multiple states, there are no major concerns about the nation's dairy supply. Pasteurization, a common process in milk production, effectively eliminates the virus. Additionally, the Food and Drug Administration assures that it's highly unlikely for infected eggs to reach our supermarkets due to efficient detection timelines. Remember, infections in humans have been rare and primarily linked to direct contact with infected animals. Safety measures such as pasteurization and proper cooking of eggs and poultry play a crucial role in reducing the risk of infection. Increased testing and monitoring of flocks, along with proper handling and cooking of chicken, are recommended. While avian influenza A, H5N1, remains a concern with awareness and precaution, we can navigate this challenge successfully.